All three medical plans in the State Employee Health Plan offer a prescription drug benefit. All prescription drug benefits are offered by a separate vendor, Caremark. When you enroll in the State Employee Health Plan, you'll receive a separate Caremark prescription drug card that you present to your pharmacist when you order or pick up your prescription drugs. Under Plans A and B, there are 5 different coverage tiers for prescription drugs. Generic drugs are your best buys. In addition to a lower coinsurance than brand name products, they cost less. Generic drugs are safe, effective, and FDA approved. The FDA requires generic drugs to have the same quality, strength, purity, and stability as name brand drugs. Under Plans A and B, you pay only a 20% coinsurance for the generic drugs. Preferred brand name drugs are listed on the State Employee Health Plan's Preferred Drug List, which is available on the KHPA website and at caremark.com. With a preferred brand name drug, you pay 35% coinsurance. Special case medications are high-cost drugs where the cost of a 30-day supply exceeds $500. Your responsibility for a 30-day supply is capped at $75. Non-preferred brand name drugs are those products not listed on the preferred drug list. Your coinsurance for those products is 60%. Selecting a non-preferred product will cost you more out of pocket. Finally, the discount tier, formerly known as lifestyle drugs, includes prescription items that are not covered by the plan, but for which you can receive a discount by using your Caremark card. These include erectile dysfunction, infertility, and allergy medications. A complete list is available on the KHPA website. Under Plan C, the Qualified High Deductible Health Plan, drugs are subject to the overall plan deductible and then paid at the specified copayment rate. The copay is $10 for generic drugs, $30 for preferred brand name drugs, and $55 for non-preferred brand drugs. The copayments apply to each 31-day supply. Plan C also includes a generic incentive provision. That means if a drug is available as a generic and you elect to take the brand name drug instead, you will be responsible for the copay and the difference in cost between the generic and the brand name drug. The preferred drug list is the same as the one used for Plans A and B. It's available on the KHPA website. For our more mature members, we want you to be aware that Medicare does not consider this drug benefit to be creditable coverage. For members who will be reaching Medicare age, this means that this is not considered a qualified plan under Medicare Part D. Since you are not allowed to carry this plan once you are eligible for Medicare, this may or may not present an issue for you. Whenever you see your doctor, you'll want to print out the preferred drug list and take it with you. For most conditions, there is more than one effective drug available. By having the PDL with you, you can discuss with your doctor what the best and most cost-effective drug is for you. The PDL is available on the KHPA and Caremark websites. Selecting a generic drug is the best buy for your pocketbook. Also available on the website is a complete list of specialty drugs, special case medications, and self-injectable drugs covered under the drug plan. In addition to the preferred drug list, the State Employee Health Plan is launching a new feature in 2010, the Performance Drug List. The Performance Drug List applies to 3 classes of prescription drugs, and, like the Preferred Drug List, the intent is to have members who are taking non-preferred brands and paying 60% coinsurance to try a lower-cost drug to save them money on their prescriptions. The 3 classes of drugs in the Performance List are blood pressure medications known as ACE/ARBs, cholesterol-lowering medications known as HMGs, and stomach acid reducers known as proton pump inhibitors or PPIs. Each of these 3 classes of drugs includes a large selection of lower-cost generic options. Under the Performance Drug List, you will still have access to generics and preferred brand name drugs. The change is in how non-preferred brand name drugs in these 3 classes are processed. If you are using an HMG, PPI, or ARB, You will continue to have access to a robust list of both generic and preferred brand name drugs. The policy change will only affect you if you purchase a non-preferred brand drug and your claims history shows you have not previously tried a generic first. The pharmacy will receive a message that the claim cannot be processed since the member has not tried the generic first. If a member has tried a generic, they will be able to purchase the non-preferred product and will be responsible for paying the non-preferred drug co-insurance. HMGs are cholesterol-lowering products. This slide shows the list of generic and preferred name brands as well as the non-preferred name brands. Again, the performance drug list will only affect you if you try to purchase a non-preferred name brand drug. Before you can fill a prescription for one of the non-preferred products, you need to have tried the generic products first. The Caremark claim system will review your claims history to see if you have previously purchased a generic in the drug class first. If there is no record of a generic in your history during the preceding 24 months, the pharmacy will receive a message that the claim cannot be processed since the member has not tried the generic first. For PPIs, which are long-lasting stomach acid reducers, the non-preferred name brand drugs are highlighted on the right in red. The preferred brands and generics are on the left in green. There are also a number of high-quality over-the-counter products available that may be less expensive than the prescription products and provide the same results. Talk to your doctor about what will work for you. You can also view the complete performance drug list on the KHPA website. Just click on the Open Enrollment icon, then click on Performance Drug List. Over the next several months, it's expected that a number of new generic drugs will become available as the patents on certain name brand drugs expire. Here is a preview of the medications we expect to have generic launches between now and the end of 2010. If you are currently using one of these items, talk to your doctor or pharmacist about moving to the generic as soon as possible. A complete list of projected generic launches is also available on our website. Convenient home delivery for your medications directly from Caremark is also available. New orders take 10 to 14 days to process. Reorders process in 5 to 7 days. The coinsurance and day supply is the same as at your local pharmacy, but with the convenience of reordering online at caremark.com or by phone 1-800-294-6324. Specialty and biotech drugs are a special group of drugs designed to treat conditions that do not respond to traditional therapies. These are drugs that are intended for home use. Many of these drugs are self-injectable medications. A complete list of the specialty and biotech drugs is available on our website. If you are prescribed a specialty or biotech drug, call Caremark Connect and they will work with you each month and coordinate the dispensing and shipping of your medications to the address of your choice. To summarize, all of the medical plans in the State Employee Health Plan include a prescription drug benefit. That benefit is administered by Caremark. Different copays and deductibles apply to different plans. You are encouraged to use generic brands whenever possible, or select a brand name drug from our preferred drug list. Name brand drugs that are not on the preferred drug list will cost you more. For certain classes of drugs, including certain blood pressure, cholesterol, and stomach acid control drugs, the plans also use a performance drug list. This requires you to try generic drugs before using more expensive name brand drugs. You can also arrange to have your prescription drugs delivered straight to your home by using Caremark's home delivery service. Specialty and biotech drugs are also available. Caremark Connect will work with you and your doctor to coordinate the dispensing of those drugs. Details are available in your enrollment packet and on the KHPA website.